All right, welcome to our live stream today at Thursday, December 21, 2023. Dr. Deuk. We have our certainly most challenging case for the day, a lady with, let me just show you, history of fusion from a long time ago. Okay, 1973. Can you see this, Henry? I'm just marking the scar that I can see right now.
Yes, we can.
Look at this thing. This is just the bottom part of her fusion. Harrington rods. And it comes up here. She had severe scoliosis. They did a huge fusion, but they didn't fuse down below. So all that stress of the entire spine is down on 2 discs. And of course they go bad over time, but the surgeons who did this are long gone. They leave it to people like me to fix, clean up. And she's having horrible left leg pain. She has a very badly pinched nerve on the left side at L5-S1. She's got a spondylolisthesis, she's got scoliosis, she's got everything going on. Are you okay there?
You okay? Yep, got thumbs up.
You're doing great, by the way. Give me an AP. So folks, there's virtually no space. Literally, getting a needle through here would be like a miracle. We were just talking about The Hunt for Red October, the movie, and the needle is in perfect position, so we're lucky we got this far. At this point, I'm going to try a little more to get in with a little jockeying of my needle, but if I can't, I'm going to put her to sleep and we're going to go in with the dilator, which I have a feeling that's what we're going to end up having to do, just because it's so tight. And I need her asleep while I go in. Oh, it went in. Unbelievable. Boy, they say it's better to be lucky than good. I can't believe we got in. I can just say that God is smiling on us today. Are you okay? She's happy. So her nerve is not being damaged by us. It's being damaged before us. Any pain? Oh, yeah. Is that where you get your back pain?
Is that where you get your pain?
Yes.
On a scale of 1 to 10, how bad is it?
Give us a number.
10 is the highest. How high does it go?
Can you give us the
Can you speak for
number?
us?
How high did it go?
8? 9, she said. 9.
9 out of 10. Her pain was a 9 out of 10, concordant at L5-S1. Can you document, please? Who's the nurse? Where's the nurse? Why are we not documenting?
She's right here.
Oh, got it. All right. Well, that was amazing. Let me show you guys the hole. Henry, can you see this?
Yes, we can.
Here's the size of a normal hole, and it's called a neuroforamen. You guys see that? Neuroforamen. It's about the size of a dime. You know, some people a quarter. The hole we just navigated through is literally this big. That little spot right there, that's how much space we had. You can see it on the MRI. It's completely collapsed. So I'm very happy. We're in the disc, in the herniation, and we're going to get started. She's going to sleep right now. Our anesthesiologist, Dr. Berndes, is putting her to sleep. She'll be asleep for the next 30 minutes, 15 minutes maybe, while we do the surgery. Shot? Now, her problem isn't so much back pain. Her problem is the pinched nerve going down her leg, which is the left L5 nerve root as it exits the foramen. Let's give some num-num. Did you already play the video? Let's go ahead and play it.
Copy that.
if it is patient questionnaires, we already do that. Survey Monkey. But we can modify it. Hold on. All right, thank you. Welcome back. Dr. Berndes and I were just talking about new regulations being imposed on surgery centers. Nope. And the Agency for Healthcare Administration, or AHCA, in Florida, is the governing body for hospitals and surgery centers, nursing homes, and the like. I want to go a little bit more. And AHCA is always updating their regulations. So, you know, creating new hoops for us to jump through. So we were just talking about that. Anyway, we are entering the L5-S1 disc. I'm not ready to take the guide wire out yet, but we're getting close. I'm just very nervous because once you take the guide wire out, you want to make sure the dilator is actually safe in the disc. Shot? And it looks like it is at this point. So hold on. Let me just think. Yeah, I think we're good. Perfect. We are in. We are in. Now, she's got a combination of soft disc herniation causing narrowing combined with bone spur and scoliosis and listhesis. So there are some structural changes that cause the narrowing here, and there are some bony and ligamentous thickening and enlargement causing the narrowing here. And on top of all of that, she has herniated disc. We're going to try to remove as much of this stuff as we can. Go ahead. To open things up. Give her nerve breathing room. Let's just see. Shot? Oh yeah, I think we're good. Perfect. So, please keep her nice and relaxed so she doesn't crimp down on my tube. All right, any questions for us?
Yes. This first one is from Steve on YouTube.
Steve, how are you on YouTube?
Their name is Steve Gunner, but I just went with their first name.
Steve Gunner?
Steve Gunner, correct.
All right.
And they ask, is this an awake surgery?
Yeah, Steve, it is, as a matter of fact. Patients are awake for part of the surgery, and they are asleep for part of the surgery. Have you ever watched awake brain surgery? Well, this is awake spine surgery. Just like awake brain surgery, we want the patient's help during the surgery to make sure that we're not causing any damage to very sensitive structures. And we do the same thing in the spine. So in the spine, we keep the patient awake to make sure that we're not damaging any vital structures. Because the patient gives us that feedback, right? There are certain things the patient can give us feedback on, and there are certain things the patient cannot give us feedback on. For example, you don't need the patient to tell you their blood pressure is dropping. We have machines that do that. We don't need the patient to tell us that their heart rate's increasing. We have machines to do that. But we do not have any machines to tell us if the nerve root is being compromised. So we have to have the patient tell us. The patient is the best way for us to know during the surgery if we're too close to a nerve that we shouldn't be. So we can back off and move to a different place. So right now the patient is asleep. So like I said, this surgery the patient's awake for just the beginning and then they're asleep for the rest. This is perfect, yeah. Great question. So we keep the patient awake in the beginning so we can get information that we need from the patient, and then we put the patient to sleep for the rest of the surgery. Once we're ready for them to not be a participant in the surgery. Two-phased. Yep, lightly sedated in the beginning, then deeply sedated. All right, so there's a piece of herniation right there. It was sticking out in the foramen. Now I'm going to use a laser to break it into pieces because it's too big to take out. And look, it's scarred down, right? I wouldn't be able to get that out if I didn't have the laser to free it up. The grabbers, endoscopic grabbers, don't have enough force on the teeth. It's not possible because they have a long shaft. Oh yeah. Well, we got a little piece of it. Because of that long shaft, the endoscopic grabbers can't get much force, right? You ever use those plastic grabbers to pick things up, you know, like your shoes or whatever? Imagine using those plastic grabber to try to pick up a 50-pound weight. You wouldn't be able to do it. Are we using the new lasers?
No, this is,
We're not using Ohio?
no, still no, because I'm waiting for the Texas.
Oh, right. Oh, yeah. Yeah, all right. Sorry. Any other questions?
Yes, these next two come from Canes25 on YouTube.
Hello, Canes25, our favorite viewer of the day.
They first question they ask, good day, God bless all of you. How's my 81-year-old friend doing after his surgery?
Ah, ha, ha. Ha, ha, ha. Thank you for asking. Your 81-year-old friend, which I don't know if he really is your friend, but if he is, great. He has 100% of his pain gone. We saw him yesterday, and he was so happy. He actually did a testimonial. So you will see his testimonial as soon as Henry gets to it. But we did 2 discs, L4-5, L5-S1, plus the DPR bilateral L3-4-4-5-5-1. He's from South Florida, right? Or is it North Florida? North Florida, Panhandle. And he turned 81 years old. And that was, it was his birthday. Yeah, that is the case. He had 100% of his back pain gone. He said for 55 years he's had back pain since he injured himself in the military. Helicopter crash, and then he said a car crash afterwards. And he said that this is the first time in 55 years since he's had no back pain. So he's doing wonderful. No pain medications. He had outpatient surgery with the Deuk laser disc repair. Yeah, he asked if he could go back home. He felt so good the same day of surgery. He wanted to leave and not come back. Yeah. Yeah, so the point is he's doing well. He actually asked me, can I have a glass of wine tonight since it's my birthday? And I said, you know what? By all means, you can have a glass of wine as long as you're not driving. So he's doing phenomenal. And like I said, we have a testimonial from him coming. But, we have so many testimonials. Henry is just gotten real busy lately. Right, Henry?
Oh, yeah.
Henry's going to have some time to work on testimonials
Yeah.
over the break.
Yes. We'll have one tomorrow for sure.
Thank you, Henry.
Yeah, we'll have more time for next week to...
But what's pretty cool, though, is we did a knee DPR today, testimonial today. Patient who has a bad knee, arthritis in the knee, and I went out and it's a funny story. My mom called me and said she lives in a senior living community nearby, and she said, you ought to come and tell them about your laser surgery. And I said, I'd love to. So we went and talked to a bunch of people last week, or I think it was last week or the week before. Anyway, as a result of me going there, we had a patient come, and he was scheduled for a total knee replacement in June. I guess they're 6 months out. And the surgeon said, we can do your surgery in 6 months. So he had 6 months to wait to get his knee replaced. And then on top of that, he'd have a year of recovery from the surgery. So he saw my talk on the Deuk plasma rhizotomy that we're doing now for knees and hips. And he came in, and Dr. Davis, our orthopedic surgeon, did his surgery. He did a Deuk plasma rhizotomy on his knee. Came in today, 0 pain meds, completely walking like a normal human being. No downtime, no hospital, no blood clots like you get with knee replacements and hip replacements, nothing. Just literally didn't even look like he had surgery. There's no redness, no nothing. And he's not on any pain meds. And his pain's 100% gone. So we just did his testimonial. Incredible what we're doing with this procedure and the lives that we're changing. You know, knee replacement surgery is a big deal. It's very painful. It takes a long time to heal. And nobody wants it. And now Deuk Joint Institute has created a new treatment that is working, and it works so well that there's really no reason to get any open surgery done anymore on your knee. So he said that he's canceling his surgery in 6 months. 6 months they were going to do it at the hospital. I mean, the poor man would have to wait all through the holidays and until June. And I know there's a backlog on these cases, and the orthopedic surgeons are loving it. They are just so happy that you're all needing knee replacements. Well, guess what? All that's gone now. Nobody needs a knee replacement anymore. You just come to Deuk Joint Institute, aka Deuk Spine sister company, and we can take your knee pain and get rid of it permanently with one 15-minute procedure. So Henry just shot that testimonial. I know because I was there. How did Davis do, Henry?
Oh, he killed it.
Not as good as me though, right?
No, of course not.
You're going to have fun doing a double whammy.
Yeah.
You know what it reminds me of? You remember those sisters that did the Wrigley spearmint gum?
Yes.
The twins? Huh? Right? So that's Davis and I now. We're like the Wrigley spearmint gum sisters. The double mint. We're tag teaming on the testimonials. All right. I've got to figure out where is this nerve. I think it's right in there. I need to get a little bit more of this material here, out of here, to get her feeling better. I'm not going to make this perfect. Nobody can. But I need to make it good enough to give her relief. Let's see. I need the grabber. Let's see what that is right there. All right. Yeah, it's because of the inflammatory condition. All of this stuff is scarred down. I've got to figure out what's disc and what's not. Holding it? To me, that looks like foraminal ligament and scar tissue. I'm going to clean a little more of that. Remember, the game here is you're never going to get 100% of this narrowing out of here. It's impossible. So my goal is to get as much as possible.
We have another question.
Yeah.
These next two are actually similar questions. This from Canes25
Mhm.
asks, "Wow, I never seen an MRI that like that. Is that the rods to the right?" And then Sherry from Facebook asks, "Why does it look like a part of her spine is missing on the MRI?"
Yeah. The reason why, Sherry, it looks like a part of her spine is missing is because she has severe scoliosis. So the MRI takes linear sequences. It takes a picture in a straight line, basically, or captures the image straight. And if the spine has twisted, it's going to move out of that plane into another plane. You're gonna lose sight of it. It's like a snake, right, with the body kind of snaky. And so what's happening is this poor woman's scoliosis is so bad that her spine, you're actually seeing the spine move in and out of the plane of the MRI. All right, this is the area I need to get rid of. It looks like a lot of it is scar tissue from inflammation. And then the other question you said was from Canes25?
Yes, he asked a similar question about the MRIs. Is that the rods to the right?
I don't know because I'm not really looking at the MRI right now, but it could very well be. I think she may have had her rods taken out at one point, if I'm not mistaken. Anybody know that piece of information?
I believe so.
Yeah. They failed? Yeah, she may have had the rods taken out. Very common, yeah. Let's see that. So I'm just moving very cautiously here. I don't want to harm anything for her, and the nerve is in here right around where I'm operating, and it's fully scarred in. So I've got to, I think about 5 minutes. I think that's going to be the last of it right there that I can get safely for her. Let me just see. Yeah, about 5 minutes left. Yeah, and because of all the inflammation, there's some bleeding. You can see that. Great questions. This is a very challenging case for those of you wondering. It's very hard for me to do, but it's also very hard for you to see because of all the inflammation and scar tissue that's here. Let's try to get a little bit more there. And that's probably going to be all that I can do. The only other option for her would be me to go in and cut out this facet joint completely, and I'd have to fuse her spine, which I know she doesn't want. Huh? It's a big surgery. Yeah. All right, let's go with the grabber again. Just about done here. I've done, as much as I can. The truth is it's never perfect. You try your best, but you don't want to hurt the patient either. You don't want to cause a new problem. And so I'm trying to balance getting as much of this stuff out of here that's pinching the nerve, along with not hurting the patient. Go ahead. That's her facet right there. So I'm taking a little bit of the facet out as well, just to create some more room. And then you can see the facet capsule is enlarged. And all of this is contributing to the narrowing of this foramen. We call this area the foramen, but it's right also next to the lateral recess. All right. See if there's anything else I can do in here to open things up a little bit more for her. I'm wondering if I can take this. It's kind of scar tissue right there. All right, let's take a look sideways. I think that's kind of a bundle of scar tissue right there. Let's see how much of that I can get. We're just about done here. Another 30 seconds. I think I'm done. Yeah, I think I'm done. I just can't get any more. That's all I can do. Wait. Let me just see here. How much irrigation do I have? I need 10 seconds. All right. All right, that's all I can do. So, a bad situation, adjacent segment disease from her fusion, which, you know, we did not do, but we cleaned out the foramen. I got about 30% of that, 40% of that material out. Hopefully that's enough for her that she's happy. We'll have to see. The nerve was getting crushed severely by all that inflammatory material, scar tissue, joint capsule, joint hypertrophy, joint subluxation, ligamentous hypertrophy, just so many things around there getting big and getting pushed into the foramen by, you know, the scoliosis that she has. So we did our best to open it up. She doesn't want a big surgery done, and I don't blame her, so we're seeing if this is going to work. Hopefully it does. Any questions?
Yes, we have two questions so far.
Go ahead and type up your questions, and I'll answer them for you. And I'll be there shortly to do that. Okay? We're just going to close this thing up and put some staples in, and we'll be done.
I've been told by so many different doctors in so many different countries that either there's nothing they could do for me or that this is just my life now and I have to get used to it. You know, like, so when you came along and told me, like, oh, you don't have to live like this, it's like, well, everyone else says I do. So, like, I really didn't believe it. I was like, there's no way. Like, I've been told now for 5-6 years, like, this is it. You're never going to play sports again. You're never going to not be in pain again. Like, this is what you have to get used to. And so when I met you and when you were telling me, like, no, you don't have to do that, I was like, it's too good to be true.
Yeah.
There's no way. And then I woke up from the surgery yesterday, and I wake up this morning, and I just haven't stopped smiling, because you were right. Everyone else was wrong.
Of course.
I feel great.
I'm Dr. Ardik Majan, and it's June 28, 2023. I'm here with one of my lovely patients who traveled from Texas. She has been, as you've heard, suffering with back pain for a long time, years. You were telling me that you've traveled, talked to surgeons around the world, doctors around the world, and they've all told you you have to live with it.
Yeah.
That's your life. The truth is that used to be the way back pain was, but not anymore. Deuk Spine Institute has made a breakthrough discovery on not just how to cure back pain, but the causes of back pain. And because we now understand the exact source of back pain in every patient, we're able to treat that specific source. For you, you had the Deuk laser disc repair. You had 2 discs fixed yesterday. Before you came here, what was life like for you?
90% of my day is in bed, laying down, pain for 5 years, pretty constant, not doing any of the stuff that like made me. Like no sports, no going out for dinners anymore because I couldn't sit for more than 5 minutes. Like I can't believe I'm sitting right now. Like it wasn't really much of how I wanted to live my life at all.
And it's not just you, but you're married, right?
Oh, my poor husband. I didn't take the trash out since 2018, which was like the one like nice thing, so I didn't have to take out the trash. But he had to do like everything for me. So it wasn't even just my life, and that was what was harder. Like he had to completely change his life. We used to travel, we used to play sports, we used to do stuff together. I got to sometimes watch movies with him if I could sit up to watch a movie, or he'd have to like get a weird angle so we could lay down and watch a movie on the ceiling together. He's an absolute trooper. He stayed with me like through all of it, never complained. But you know, like that's not what you want for your partner. That's what you don't want that for their life.
And can you imagine when he heard the news from these other doctors telling you you have to live your life like this for the rest of your life? Can you imagine how he felt? And he stuck around.
Yeah. No, I mean, like, I feel so lucky that I had a partner who was prepared to do that, but that only made me feel worse that I was making my partner do that, you know? Like, it's one thing for yourself to be going through the pain, but it's another thing to see how your pain really impacts all of those people around you. Like, my little brothers who used to see me as kind of this tough, can do anything for them, older sister, were taking care of me and carrying, like, my bags if I needed anything and had to pick stuff up for me. Like, my dad just every day worrying about me, and I was always the tough kid, like never had to worry about me at all. So it's just such a weird, uncomfortable, terrible paradigm shift.
Sitting here today, less than 24 hours after your Deuk laser disc repair, how much of that pain do you have?
None of it. I have none of it. I can't believe I had surgery yesterday. Like I just feel better than I ever thought I could feel again. Like I never thought in my life I'd get back to this point. So.
And this point being?
No pain. I don't have any pain. I can sit and my left leg hasn't gone numb on me. I can smile and have a conversation without the pain in the back of my head making me want to just lay down and not do anything. It's crazy.
And what would you say to the people out there living with back and leg pain?
You don't have to. Just call Dr. Deuk. Even if you're skeptical like I was, like call him, see what he has to say, explore the option, and just give yourself the gift of your life back.
Totally agree. One question, are you feeling this way because we've given you powerful narcotic painkillers?
No, I'm not on anything. I actually didn't even take the Tylenol extra strength. I 100% nothing. I had water and a little bit of coffee this morning. That's it.
And this is part of what's revolutionary with our technique at Deuk Spine Institute is curing pain in the back and neck, no hospitalization, outpatient. You went home an hour after your surgery.
Yeah.
And no painkillers afterwards, because we're not doing trauma to your body during the surgery. The reason patients need pain medicine after surgery is because the surgeon is hurting their body with the surgery. Do you have any pain after the laser surgery?
None. I wasn't anticipating this at all. I have none. I feel fine. I don't feel fine. I feel great. It's really surreal still.
And you can see during your surgery, we made a tiny little 7mm incision, tiny, 1/4 inch. And we did the whole surgery on those 2 discs with the laser, cleaning up. There was a lot of scar tissue at L5-S1, and there was not as much scar tissue, but you had a small tear at 4-5, and we were able to clean those tears up with the laser and get rid of your back pain. Congratulations.
Thank you.
Is there anything you want to say to your fans out there and your family?
Oh, man. I can't wait to do stuff with all of them again. I can't wait to like go on trips and carry my own suitcase and hike and play sports. Not for 1 year,
Not
I
too
know.
soon.
Not too soon. No, it's all in the future, but just knowing that it is in my future again is like, it actually is life-changing. So thank you.
You're welcome. Congratulations.
Thank you.
You're welcome. All right. Well, lovely testimonial, and we've just completed what I consider to be the hardest type of surgery to do endoscopically with the transforaminal approach. Are we good?
Yep.
All right. So we are going after a pinched nerve, right? Literally right here. I don't know if you guys can see this metal clip, but that's where the nerve is getting pinched. And my approach was through this little hole right here. Okay, can you guys see down that hole?
Yeah.
Right there? There's like no room, right? And on top of that, the disc was collapsed and the bone slid forward. So we were lucky, we got in. with the patient awake, guiding me to stay away from her nerve so I didn't damage anything. We got the tube in. I started cleaning all that scar tissue and junk out of there. There's a lot of thickened ligament. We call it foraminal ligament that gets thick with arthritis, and basically a lot of it's due to the instability and the twisting of the spine over the years, thickening of the ligaments, thickening of the capsule, thickening of the bone, all of that contributing to what's called foraminal stenosis, which he had. You can see it on the MRI. Anyway, I got in there, we used a laser, we cleaned out a good amount, probably 30%, if we're lucky 40%. Hopefully that's all she needs. You never know. And anyway, my aunt is texting me saying, my insurance won't cover the cost of your Deuk plasma rhizotomy. Could you send me the cost, out-of-pocket cost? This is my aunt. Anyway, I told her I would take care of it, but point is, here's my aunt coming from California for the knee DPR, and she's worried about the cost because the insurance won't pay. So it's a common problem, folks. We got to hold our insurance companies accountable for paying what we need done, and the only way that happens is if you fight them until we get the laws changed where they can't deny treatment, which is exactly what needs to happen, folks. If you're wondering how do we bring about medical reform in the United States to improve the quality of care that patients get, the answer is simple. You must take away the insurance company's ability to deny payment for medical care. They can't get to pick and choose what they want to pay for. If they can, they will deny everything, and they are doing that now. All right, so the surgery went well. We had a narrow corridor at 5-1 on the left. Anatomically, in her case, the slippage of the bone, the enlarged facet, the twisting of the spine, the collapse of the disc, shut everything down, made it really hard to get in, but we were able to get in there and clean it out. All right, let's take our first question.
Yes. This first question.
Sorry. Before we do, I've got to show you the cup that my staff bought me. I think it's the coolest thing in the world, the Spine Whisperer. And like I was telling Henry, in that case we just did, when I was putting that needle in, I was whispering, oh my God, am I going to get this? This is so hard. I don't know if I can get this. It's going to be impossible. Oh Jesus, please help me. So, right, I was praying and begging under my breath. So I was whispering, and I was whispering to the spine. So I think that my whispers were heard and answered.
Yes, sir. It's effortless. This first one will come from Phil on Facebook, not Facebook, YouTube.
Hello, Phil on YouTube. Thanks for joining us and asking a question.
They said, I hear much about pain from your live stream. Can you discuss mobility issues? I have herniated disc at L4 to L5 for 7 months. I struggle bending forward to put my socks on. Can disc cause that restriction?
Yes, disc pain can cause so many problems. Namely, disc pain can cause pain in your lower back. It can also get onto your nerves and cause pain down your legs, weakness in your legs, numbness and tingling. All that can be fixed with the Deuk laser disc repair. So, yeah, the problem with these disc injuries, Phil, is that if you get a disc injury, you're in pain all the time. It only gets worse with activity. So, of course, it's going to restrict your movements, right? Because activity is movement. The more you're moving, the more you're aggravating and stirring up that herniation. Think about a zit on your face, right? The big old pimple when you're a teenager. Man, it's red and tender. So what's going to happen when you put your finger on it? It's going to hurt, right? But then what if you start rubbing it around like this? Like, you think it's going to feel better? Hell no, it's going to feel worse. That's what you're doing to your herniated disc, your annular tear. You're getting up, moving around, you're rubbing on it, you're aggravating it. You're only going to make it hurt more. What we do is we go in there and pop that zit. We go in there and fix it so that it drains, it never comes back. We're the only doctor in the world that does this. It's called the Deuk laser disc repair. We're the first ones to publish it. We published it back in 2012. So we're talking about 12 years ago. And we've been trying to teach other doctors about it, but unfortunately the industry that sells screws and rods, the industry that does laminectomies and discectomies, they don't want you people knowing about this treatment, so they're blocking it. So that's where we get the word out any way we can.
This next question comes from Dr. Smile Designer on YouTube.
A dentist
Oh.
or oromaxillofacial surgeon, smile designer. Nice to have you here.
They asked, is this live surgery?
This is live surgery, my friend. If you're watching it on December 23rd, 2023 at 1:45 Eastern Standard Time. Yes.
I think it's 21st.
Oh, sorry. Did I say 23rd?
23rd.
I'm just hopeful for Christmas. There it is, my friend. Ugh.
There we go. Perfect.
All right. It's live surgery. If that's what time it is, Eastern Standard Time where you are, then you're watching live.
Perfect. This next one comes from Steven on YouTube.
Hello, Stephen, again.
Asking, love watching this. I've had back pain for over 25 years. Do you get many patients from Canada? I have tried everything and now waiting for an MRI, which will take a year to get to be the same thing.
We love patients from Canada. Here's my Canadian scheduler, as a matter of fact. He does a great job for the Canadians and helps you get down here. So yes, we have Canadian patients all the time. They come in for 3 days, right?
Yep,
Sometimes
3
they stay
nights,
a little
4
longer.
days, yep.
And they like Florida because it's so nice down here right now. Come down here to Florida, we'll fix your back. Doesn't matter if you've had pain for 1 year, 10 years, 20 or 30 or even 55 years, like the patient we cured his back pain 2 days ago. Go back and look on our YouTube channel. Go to the live playlist or live section. Go down until you see DLDR, right? Deuk laser disc repair, L4-5, L5-S1, and DPR bilateral L3-4-4-5-5-1. It was just 2 days ago on December 19th. Get my dates right. And you can watch that patient, 81 years old, born in 1942 during World War II, excuse me, and he had pain for 55 years. His pain is 100% gone right after our surgery. It's going to stay that way. We do this all the time. We cure back pain and neck pain. So come down here and get taken care of.
Adding to what Steven said, this is showing me there is light at the end of the tunnel now. Provided I can afford it, what does it normally cost?
I wish I could tell you the cost. The cost depends on how many discs are we fixing. Are we fixing 1 disc or 2 discs or 3 or 4 or 5 or 6? And then are we going on the right side, the left side, or both sides? Are we going right, left, both on all the discs or some of the discs? So it depends on a lot of factors, but it really has to do more with how many discs we're fixing, how many sides we're fixing, and is it your neck, your thoracic, or your lumbar? So we do all that with a free MRI review. Just go to mri.deukspine.com, fill out the form, send us your images and your report, both, not just the report, and then I'll look at that, I'll meet with you, I'll go over it with you in 10 minutes, I'll tell you exactly what needs to be done to fix your back. Then we can price it out.
This next, I believe last but not least, comes from Cosmic Knight on
Cosmic Knight. My favorite name on the internet or social media.
Honestly.
All right. What does Cosmic Knight have for us today?
They asked, Dr. Deuk, I mentioned before having numbness in my tailbone and urethra. The good news is that there's no more numbness in my urethra, but I still have numbness in my coccyx. What could be the cause?
Numbness in the coccyx, I mean, I would need to see exactly what you're talking about. But the coccyx is a little bone. It's located literally, if this is the anus, it's right above the anus. Like literally, if you push above your anus, not in the anus, but above it, there's a bone right there, that's your coccyx. If pushing on that is tender and sore, then you have coccygeal ligament inflammation. The treatment for that is to do a shot in the coccygeal ligament with steroids and numbing medicine to get rid of that inflammation. Sometimes you have to do it twice. We do that here at Deuk Spine. Numbness, on the other hand, means I'm not feeling anything. And if you're having coccyx numbness, I mean, maybe you're having rectal numbness or anal numbness. And if that's the case, you're going to want to have a doctor get an MRI of your pelvis. with and without contrast, and look for something that could be causing numbness in that area. The other thing you're going to want to do is see a neurologist and let them know. Neurologist. I'm a neurosurgeon. So there's three types of neurodoctors. Well, yeah. So there's psychiatrist, there's neurologist, there's neurosurgeon. We're the ones that do all the surgeries. These two deal with, medical problems that don't require surgery and, psychiatric problems. It sounds to me like it's a neurology problem. And it could be related to, and I hate to say this because I don't want to freak you out, but sometimes there are certain types of lymphoma or cancer that gets to those nerves down there first, and people present with numbness in that area. So you're going to want to talk to a neurologist and get it worked out, okay? But if it's pain you're talking about, that could be coccydynia.
And then we got another one from Phil, once more on YouTube.
All right, Phil's asking good questions.
They ask, what's the risk of re-herniating the disc? Your procedure compared to a discectomy, my surgeon suggests fusion because of that risk.
Yeah, please don't get a fusion, Phil. You don't need it. Your surgeon is just trying to make some money off of you. There's nothing wrong with making money, but you should be doing what's best for the patient, not what's best for the surgeon. Fusions, I've done 1,000 of them on the lower back alone. I've even published papers on it. That's how many fusions I've done. The risk of reherniation with my surgery is 1%. We see 1 in 100 patients reherniate. We've now done 1,850 plus or minus Deuk laser disc repair surgeries, the endoscopic ones. We've been doing it for 17 and a half years. In that time, we've seen about 19 patients reherniate. So we're right on target for 1%. I will tell you this, you will not reherniate if you do what you're supposed to do after surgery, if you don't break the rules. So no heavy lifting, no bending over, picking things up from the ground for 3 months, and avoid activities that cause loading of the disc, like bouncing up and down, horseback riding, for example, galloping, riding a lawnmower where you're bouncing up and down. The people that reherniate are doing things they're not supposed to do. So as long as you take care of your back, you won't reherniate. The reason why microdiscectomy reherniates is, first of all, the surgeon is not cleaning the walls of the tear like we do with the laser. They're not doing it. So they're leaving the walls all raggedy and disgusting, and your disc will never heal at all with that raggediness. So you've got to do what's called a debridement. That's why we call it an annular debridement. Without the debridement, you're not going to get the healing of the annulus. So a microdiscectomy is a procedure that not only does it not debride the annular tear to allow it to heal properly, but it also takes bone and ligament away from your spine, making your spine weak and wobbly. So you got the weak and wobbly plus the annulus that can't heal because you didn't debride it. That's why microdiscectomy sucks. It's not a good surgery. We don't recommend it. So your surgeon is offering you the best surgery that surgeon knows how to do for you, but that's a horrible surgery for you because you should be getting a lot far less invasive Deuk laser disc repair.
Lastly, this is not a question, this is for a comment or seeking advice from Steve, once more on YouTube. Saying, for the last 7 years, I get leg pain down my right side that keeps me from sleeping well. The spine center where I live just did a TFESI. I am hoping it helps, but guessing I may need your treatment.
Yeah, the transforaminal epidural steroid injection, it's just unfortunately a Band-Aid. It'll give you at most a few days, few weeks, few months of relief, and then the pain will be back. Epidurals are a waste of time and money. In my opinion, the only reason to do an epidural is if you're, like, let's say you have a job or you're getting married or something important in the next couple of weeks, you don't want to go for surgery, go get an epidural, right, until you get back and then do the surgery. But the surgery is the way to go. And the surgery, the best surgery for your problem is what we're doing right here, the Deuk laser disc repair. All right, we'll be back. We have 2 more surgeries. They're both single levels, so they're quick. And then we'll be done for 2023. And I'm going to send all my staff off for vacation to hang with Santa and the elves. And and whatever else they do. So very nice having you, and hopefully you'll join us for the last two cases.